Hello, viewers. Welcome back. Welcome back to one more session with America Doctor Channel. Today, I'm going to talk about a very interesting topic: the brain stroke. Unfortunately, we might have seen at least one or two family members that might have suffered from stroke, and you might have seen the residual effects of the stroke, like paralysis and all that stuff, right? So in this video, I'm going to talk about five important things or five important facts that everyone should know, right? Even a common person, you don't have to be a doctor to know these things. All right. First and foremost, first fact number one, there are two kinds of stroke, two major kinds of stroke. One is called ischemic stroke. The second one is called hemorrhagic stroke. In ischemic stroke, which is very common, what happens is the blood vessels that supply blood to your brain are clogged, with all the fat deposits, with all the high blood pressure and all that stuff, it gets clogged and blood flow to the brain is decreased, you know. And sometimes blood can clot in some other locations and can block these blood vessels. So this can cause blockage of blood flow to the part of a brain and can lead to paralysis. So this is one kind, the major kind. The second one is called hemorrhagic. So what's happening in this is the blood vessel is burst open and blood starts to bleed out in your brain. Unfortunately, there is not much space in our brain. So when the bleed happens, it kind of swells up and causes a lot of damage to the brain tissue and also poor blood supply to the brain tissue too, right? So this is fact number one, two kinds of stroke. Fact number two, brain cells don't heal. Once they're dead forever. And each minute after stroke, you're losing 2 million brain cells. So each minute that you delay getting treatment, 2 million cells are dying. Right the moment you develop stroke, that's when you notice all these effects like your hands, legs are weak and stuff. So if you delay the treatment, then you are going to have catastrophic events. Okay. Fact number three, anyone can recognize the symptoms of stroke. It's very easy. Just memorize this thing. FAST, FAST. F stands for face. If you look at the face of a person, if you see that if when they are smiling, their face droops like this or this, then you need to suspect that they might be having stroke. The second thing that you can do is ask them to stretch out their hands. If they can't stretch out their hands like this, or they're dropping their hands, or they're not able to lift the hand, it means that they could be having a stroke. you know the third thing is if they can't speak properly, when they try to talk but you don't understand. So F stands for face, A stands for arms, S stands for speech. And what does the T stand for? T stands for time, which I'm not going to talk about in the next fact. you know so the next question is, are these the only symptoms of stroke? No, there could be other symptoms of stroke too. The patients could be having some confusion. They could be having some problems with the vision. They could not be seeing anything. Sometimes, the patients could be feeling dizzy. They couldn't walk. These are very some of the signs that we see with the stroke. Okay. Next, like before, the fact number three, I said time. Fact number four, time is very essential. There are treatments, if given an appropriate time, can prevent paralysis. Even though you had a stroke, you can prevent paralysis. So there is a treatment called TPA or thrombolysis. Here, what we do is this medication that we give can dissolve the clog or the blockage in your arteries. So there are some indications where we give this medication. A trained doctor will decide when to give this medication. If given within 3 hours, the chances of preventing paralysis are high. Some patients can go up to 4.5 hours, right? So time is very critical. Fast. Remember this thing. Recognize the symptoms of stroke and act in timely manner so you can prevent paralysis. Fact number five. Unfortunately, stroke is the fifth leading cause of death in the developed country like US, and it is totally preventable. Stroke is totally preventable by doing lifestyle changes. I'm going to talk more about the lifestyle changes in another video, but I want to show the importance of why we have to do lifestyle changes so that we can prevent stroke and we can prevent paralysis and death. All right. So again, for giving you an example, in US, when someone has a stroke or when they call the healthcare facilities or the EMS or emergency medical services, everything is kept ready, and the patient, the moment he steps into the ER, we try to get the scan within 30 minutes of the brain to see if he really had a stroke or not. And within 45 minutes, we have a plan ready, what to do, how to treat this patient, how to prevent the complications. So that is why it is very time critical that if you recognize that someone is having the symptoms of stroke, act fast. All right. Thank you so much. I hope you guys like this video, and if you like it, please share and subscribe to my channel. I'll be making many more such videos. Thank you so much. Have a good day. Thank you.
మీరు నా ఛానల్కి సబ్స్క్రైబ్ చేసుకోవాలనుకుంటే ఇక్కడ కనిపించే సబ్స్క్రైబ్ బటన్ మీద ప్రెస్ చేయాలి. చేసిన తర్వాత అక్కడ బెల్ ఐకాన్ కనపడుతుంది. బెల్ ఐకాన్ కనపడినప్పుడు అక్కడ ప్రెస్ చేస్తే నేను చేసే కొత్త వీడియోస్ అన్నీ మీరు చూడొచ్చు.